We're here today with Dr. Doug Gruenbacher, and we have some questions about blood pressure today. So, Dr. Doug, first of all, really what is blood pressure?
Right, so blood pressure is basically the body's measurement that is a measurement of the pressure of the blood after the heart pumps and then as it relaxes.
Okay, and what's a normal blood pressure?
So a normal blood pressure is about 120/80. It does vary throughout life. Babies will have lower blood pressure, and as we get older, we have higher blood pressure. But as an adult or adolescent, once we're full grown, 120/80 is a normal blood pressure.
And what can make that vary, or what can be a high blood pressure, dangerous blood pressure?
Things that can cause blood pressure to be elevated is too much stress. Exercise will actually make the blood pressure go up. Certain foods, high salt diets will make the blood pressure go up. Anything that causes the body to have a stressful response can make the body go up. So that can be infections. On the other hand, sometimes blood pressure will go too low. Blood pressure can go low when you have an overwhelming infection. If you're dehydrated, it can get too low, and then you would get the most common side effect of that or outcome is dizziness, lightheaded, and so on.
All right. So can you have high blood pressure and not know it?
Absolutely. One of the classic things that we talk about with high blood pressure is that it's a silent disease. And what we mean by that is you can have high blood pressure without any symptoms at all. Now there's some things that I do want to clarify though too on that is that a lot of people with high blood pressure do have headaches, visual changes, they can have chest pain, they can just feel generalized fatigue, malaise, just not very well at all.
So what's the best way to make sure that this isn't a problem? Blood pressure is not a problem.
In general, we want to make sure that people get screened for high blood pressure at least once a year. We start out at a young age and then also check it yearly for the rest of their life at least. If people have had elevated blood pressures, we start to keep a lot closer eye on it and check more periodically, more frequently.
Last question, Dr. Doug. When you say screening for blood pressure, what do you mean by that?
So screening for blood pressure is just a general measurement of a cuff on the arm where it measures the blood pressure in a routine fashion where we check the systolic and the diastolic. And the reason why blood pressure is so important is that it is the most preventable cause of heart attacks, heart disease, stroke, kidney function. So it really is one of the most important things that we do as physicians. And if we can get people to have good blood pressure control, we'll decrease a lot of problems in the future and save a lot of lives.
Okay, very good. Well, thank you so much for your time.